You've got more chance of winning the lottery than you have of getting through to my GP.
Hello viewers, welcome back to my channel. Today is the 5th of July and today we should be talking about the NHS. The NHS was founded on 5th July in 1948. As you saw in the clip that started this video, some people in the UK are not happy with the NHS. Believe it or not, even some doctors in the NHS are not happy with the NHS. So the issues are manifold. There are people complaining about the inadequate care, understaffed conditions, long waiting lines, pay that is not matching up to inflation levels, and so on and so on and so on. Why are there so many complaints? It's because people can complain and people should have the ability to complain freely with a view to improve things. The NHS, which for those who don't know, the National Health Service is a publicly funded healthcare system in the UK. Largely people in the UK do not have to pay for visiting doctors, for availing medical facilities, for undergoing surgical procedures. This was not always the case. As I said, NHS only came into being on 5th July in 1948. Before that, people in the UK were expected to pay for doctor visits, pay for surgical procedures. Can you imagine a healthcare system like that? I know it is difficult. In 1909, a minority report of the Royal Commission on the Poor Law was published. This was headed by the socialist Beatrice Webb. This was not the minority report made by Steven Spielberg featuring Tom Cruise, but this minority report in the UK severely criticized the mindset that people living in poverty should be entirely accountable for themselves. How can people living in poverty avail healthcare? It might be unaffordable to them. The basic premise was healthcare should be affordable to everyone. There should not be a two-tier healthcare system, one healthcare for those who can afford it and another healthcare system for those who can't. Again, I think it sounds revolutionary, but it has come into reality in a country like the United Kingdom after decades of work. Let me highlight that here. So in 1909, when the minority report was published, it was largely disregarded by the government of that time. In 1912, Dr. Benjamin Moore, a Liverpool physician, published his opinions in the dawn of the health age. He is believed to be one of the first people to use the phrase National Health Service. But even after this, almost 3 decades later, the idea of the NHS gained momentum with the publication of the novel The Citadel, written by A.J. Cronin. In this novel, the medical ethics and the practice of medicine was highlighted and it was severely criticized. The inadequacies of the then healthcare system was brought into sharp focus. This was highlighted even more during the Second World War, where an emergency hospital service was started to care for the wounded in the war effort. This made it very clear to people that after the war they needed a healthcare system which was comprehensive, which provided care to people irrespective of their ability to afford it or not. This led to the publication of the white paper on the NHS by the then Conservative Health Minister Henry Willink, and later on, after the Second World War, when the Labour government came into office, headed by the Prime Minister Clement Attlee, who was also the Prime Minister when India gained independence in 1947, the Health Minister of the Labour government, Aneurin Bevan, started the National Health Service on 5th July in 1948, I believe in Park Hospital in Manchester. Over the decades, NHS has undergone changes. There have been improvements that have been made to the system. Some tinkering has happened inevitably because it is a system that is responsive to complaints. And over the last 10 years, the predominant complaint has been regarding the long waiting lines. People have had to wait for a very long time, especially for non-emergency care or what we call elective care. However, even though some care may be not an emergency, but somebody who requires a hip replacement or somebody who requires to undergo cataract procedures may feel that they need to get it done as quickly as possible. Even doctors have highlighted issues related to inadequate pay or pay not keeping up with inflation levels. This has led to industrial action. This is something which I have highlighted in my video titled Why Some Doctors Leave the UK. And the issues need to be sorted out. One of the interesting things that I found out while researching this video is there are tons of videos on YouTube talking about the problems plaguing the NHS, and some of these videos are in fact made by British public broadcast services like Channel 4. Imagine a world where public broadcast systems could criticize government policies with a view to improve things. This is how it should be. And I do feel good that uh, people in the UK can criticize the NHS. Even doctors, patients, all of them can criticize the NHS because all of them have a stake in it. All of us who have a stake in the NHS want the NHS to improve, and I certainly hope that the improvement happens in a very short while. Thank you for watching this video. Take care, bye bye, and please be awesome like the NHS.